find that most of the HIV infection comes in due to gender-based violence or violence against women.
Like in the rest of sub-Saharan Africa, adolescent girls and young women in Uganda are at a higher risk of HIV infection compared to boys and men. This is due to a combination of biological and socio-economic reasons, including gender inequality, poverty, lack of education, and limited access to youth-friendly health services, among others. 23-year-old Susan Ajok Trishila, a single mother of one, lives with her parents in the suburbs of Gulu town in northern Uganda.
It was not easy. No, in our clan, like, girls are not supposed to go to school. I've been even getting a lot of problem to some of my brothers because they could complain they're wasting money on me. I should be home. But thank God my mom was there to at least talk to my dad. And even from home, some of my brothers were pushing me, get married, what are you doing? Okay, a lot of vulgar language were on me. I was stuck. I even decided to run away from home. I ran from here, I went and stayed up to Germany. No one even knew where I was.
Susan's story is not different from many of the women in Gulu district, northern Uganda, a region that was ravaged by civil war for over 20 years and is beginning to find healing. But for many adolescent girls and young women here, recovery is still elusive.
I'm time on a footpath journey in dreams. One a better jack like a gangwa. They come out of my berry yen. I know a comero, petty me na Jimmy when man mirror. Kira pen the my can tell our yen between a gang quam, or where chula. I know, Jack Radical Mogo. I know it Emmanuel.
In an effort to reverse this trend for these girls to be more resilient in the face of HIV, the PEPFAR-funded U.S. Agency for International Development, USAID's Strengthening Decentralization for Sustainability SDS program, started implementing the DREAMS initiative in 4 districts in northern Uganda. Targeting girls between the ages of 15 and 24, the goal of DREAMS is to help girls develop into determined, resilient, empowered, AIDS-free, mentored and safe women in order to reduce HIV infections.
At first I thought I had no future. I thought everything was done with me. But when I went through the stepping stone methodology, I picked hope. I said, yes, I think I still have a future or a better future to come for me.
Under DREAMS, USAID's SDS program coordinates activities of 5 other implementing partners to ensure that these girls and young women stay HIV negative and that those girls that test HIV positive are enrolled onto care and treatment services. The AIDS support organization, TASO, is one of the implementing partners.
TASO core activities under this project, we've been providing HIV testing and counseling, which is an entry point for one to enroll as a peer.
Since DREAMS was launched less than 1 year ago, the initiative has mapped over 20,000 adolescent girls and young women, of which over 6,000 were provided with HIV testing and counseling services. Luckily for Susan, she tested HIV negative after joining DREAMS. Today, she is one of the 230 DREAMS peer facilitators that provide fellow girls in their communities with safe spaces to meet, share and learn weekly on a range of topics including HIV prevention, family planning, prevention of gender-based violence and economic empowerment, among others.
The DREAMS initiative is really part of a broader strategic approach of the Uganda program here, because what we've realized is that the average Ugandan is a 14-year-old girl. And so these programs are very important to try to find ways to help these young girls find a better pathway so that they can realize their potential, to feel victorious and feel like they're triumphing over their lives and being able to succeed. And given the conditions that most of these girls face, that is a very, very, very important contribution.